Before I hand over to the speakers for a bit more of an introduction about themselves, I'd just like to go over some housekeeping rules. If everyone, apart from the speakers, could keep their cameras and microphones off during the discussion, just to prevent any distraction. And feel free, as we go along, to add any questions into the chat. And we'll have a question time at the end. So if anybody wants to unmute and ask questions, and then that would be great. Okay, so if I could hand over to the speakers, if Kelley would like to start just with a brief introduction. Oh, I think Kelley,
Okay.
you're on mute.
I am indeed. Hey, I should know that by now. About 5 minutes, so that be what you're hoping for, or shorter?
Yeah, 5 minutes would be great.
Okay, so I've been asked to really talk a little bit about my background, I guess, and experience related to WHO specifically, because given the subject of this session. So let's see where I start. Well, my background is actually not clinical. I'm a social scientist. I didn't follow my father's advice about the short list of professions that I was supposed to follow. So I studied English literature and international politics as an undergraduate, much to his dismay, and thought I was going to be a journalist at one point. Ended up fascinated with international organizations. So this is the connection with WHO. I ended up 4 degrees later studying an international organization known as the International Telecommunication Union, which is another specialized agency within the UN system. So I did my doctoral research on that organization, interested in the kind of collective action that organization provides, specifically in the telecommunications sphere. So every time you use your phone, you know, for example, your mobile phone, it's because of the ITU and it's kind of collective action around radio frequency spectrums and geostationary orbits and things like that. So from there, I was very fortunate to land a research fellowship at London School of Hygiene and Tropical Medicine. Not what I expected coming out of my PhD, but was the break of my career in retrospect. Ended up landing right in the middle in the 1990s of all this early discussion around WHO and WHO reform. Very much in the news now, but back in the 90s, it was prompted by a lot of things, mainly, I think, a disconnect increasingly between how WHO is structured and how the world was changing, what we now call globalization, but you know, many different things going on. Donors weren't as happy with WHO as it was previously, and so I, as a young early career scholar, ended up being given the opportunity to participate in a number of very high-level studies, donor-driven, about WHO. So I worked with Dr. Jill Walt at the time at London School, and we participated in 2 studies of WHO, one on the financing, which is a huge issue now, and also the role of the country offices. So that was a really, really interesting time. And I also got invited to participate in a 3rd study that was going to be led by the Japanese Ministry of Foreign Affairs, but that actually didn't happen in the end. So there was the election of Dr. Brundtland in 1998, and that led to that review being canceled. That was going to focus on the regional offices, another big topic, of course. So it really provided me with an opportunity to have an insight into how WHO works, was in the room with donors as well as WHO staff, understanding how the organization is funded, how it operates on the ground, and so on. So it was probably a unique opportunity for someone at my career stage. I then went on to continue to study WHO, contributed to the Commission on Social Determinants in Health. I chaired a resource group that looked at globalization, trade, and health for WHO. And then eventually I co-founded and directed a collaborating center on global change in health. And along the way, was able to work with a lot of WHO staff on specific issues, trade, infectious diseases, tobacco control, and so on. And then the final thing I'll say about my career with WHO is that I also had the opportunity to step back and study the organization as a scholar and as a particularly as a scholar of international organizations. So I kind of played that dual role, and it was sometimes a tricky thing to balance, but I really wanted to bring also, you know, a critical eye to what the organization's strengths and weaknesses are, how it could do better, how donors and member states can do better, and so on. And so the politics of WHO. So I ended up writing quite a bit on that, and contributing to a book that is still used, but I think needs updating, that apparently is given to new WHO staff when they started the organization. So that was quite a thing to hear. So that's me really, and I have written recently, because of everything about WHO in the news, have written a piece for global governance, which is about, you know, how do we go forward past the pandemic and strengthen WHO, and perhaps think in more innovative ways about what role it could play in a highly interconnected world. So I'm looking forward to participating in this conversation today. Thank you.
Thank you, Kelley. Okay, next could I ask Diah to just tell us a little bit more about herself?
Hello, everyone. Hi, Kelley. Nice to finally put the name to the face. I've been given that book when I joined WHO just during the induction. Yes, I specifically remember. I joined WHO only recently, in the beginning of 2018, almost 3 years now. And my job specifically is to ensure that two main drivers, that is gender and youth, are the priority, remain on the top priority of WHO. In this case, it's the priority of the Director General. My background is also non-clinical. I'm a psychologist by academic training, a management consultant with specialization in corporate restructuring and strategic communication by way of professional training. I was just a regular person joining in the workforce of the private sector or of a corporate business until the president's office one day just plucked me out of the crowd to work in the president's office for the Millennium Development Goals. That was now 11 years ago. And then little did I know at that time that I was not returning back to the corporate world. I was to remain in the development sector, in the government side or policy making side of things. I set up a civil society organization 6 years ago. On December 8th, it will be 6 years, specializing in youth, meaningful youth engagement in health, specifically primary healthcare. The organization expanded, and I was then again recruited by the Minister of Health to be her, at that time, to be her special advisor on sustainable development goals and partnership, because I was the Indonesian government co-negotiator for the SDG. And then I was in the job for 3 years, and then Dr. Tedros recruited me to essentially build a new platform to ensure meaningful youth engagement with WHO. And the WHO Youth Council will be launched soon, within days, and we will hopefully after that council can be the umbrella to be the umbrella and the platform of engagement of young people, collaboration with WHO, expand the network, enhance the innovation, chart new waters on youth in policy making, in health policy making. And I hope that the infrastructure can be strong enough to have such mechanism in countries, and to have, you know, a truly global engagement of young people in health globally, from country, perhaps subnational down to up to the global level. This time I'm starting from the top, but I believe the bottom infrastructure is already there. We will need just to tap into it in due course. I look forward to joining the discussion today. Thank you.
Thank you, Diah. And could I ask Sridhar to say a little bit about himself?
Hi, everyone. Good morning to some of you, particularly Professor Lee, and good afternoon and good evening to most of you. So I'm just going to take a couple of minutes to tell you a little bit about my background and then my relationship with the WHO. So in terms of my background, I work at King's College London. I work at the Global Health Institute, where I have a title called Associate Professor in Global Health and Philosophy. And then I'm the Deputy Director of the Institute. So the reason that I have a title called Global Health and Philosophy is that I am interested in two things. One is that I am mostly interested in ideas around ethics, equity, and justice, particularly global justice and human rights. And then I'm interested in health. So it all started really because I was going to be a doctor like every other Indian immigrant. And I was going to a university where you could enter medical school at the same time as an undergraduate education, which is very rare in the US. And so it's very, very filled with Indians. But anyway, so at that point, what happened was that there was an event that happened at that time that was profoundly sort of affected my thinking, which was that there was a major catastrophe in India called the Union Carbide explosion, where there was a company that sort of released toxic fumes and killed, or sort of a number of thousands of people died as a result. And there was actually no justice for these people. And this was a very interesting case, but a very tragic one that showed the importance of transnational response and regulation infrastructure in dealing with health issues, particularly the fact that these people died, and what could have sort of been a really good response was actually allowed to slip through the hands because the company was an international company, the people were poor, the government was ineffectual and didn't have any positions. So there was sort of those kinds of things really raised my attention about international law and the way that international law and the UN system and international system affects the health and well-being of people, particularly in crises. And then what happened was that when I was in college, the AIDS epidemic happened and began to happen. And at that point, it was largely considered to be an issue affecting gay men in rich countries. But we knew that it was also affecting lots of people in India and lots of poor people, particularly poor women who were trafficked into sex work or undergraduate people. So I ended up actually working at Human Rights Watch, and I was the first person at Human Rights Watch to look at a health issue from a human rights perspective. And so that resulted in lots of work. This is how I got into philosophy, is because repeatedly people would say there's no such thing as human rights, or there's no such thing as a right to health. It says so in the law, but that law is wrong and misconceived, so it doesn't really exist. And so the idea was that I wanted to do philosophy in order to make an argument for human rights and particularly the right to health. So that's the kind of background. If you're interested in more in that, I can tell you more about it. But my relationship to the WHO is a very funny one, which is that I went to lots of fancy universities, and it was expected that there was constantly, the professors were flying back and forth between Geneva and New York, or Geneva and Boston. And it was a very funny kind of thing. On the one hand, people would say how awful the WHO is. And on the other hand, they would say, I'm so sorry, I'm really busy. I'm off to the WHO to be on an expert committee. And we were supposed to be impressed. So I never understood why something could be so awful, but also at the same time, you flew off at the instant to go and be on this expert panel. So that has always been my kind of understanding of not only the WHO, but other UN organizations. But at that time in the 1990s, late 1990s, and I'm sort of sorry to be rambling a bit, but the WHO did not have a very good reputation. It had, in fact, a very bad reputation as being sort of very corrupt at the top, not very effective, sort of filled with people that were not very good. And then in the early 1990s, then it also started becoming very controversial because it started to implement kind of measurements and ranking of countries, which started to become very interesting because suddenly countries were being compared about their health. And so this started to become quite interesting. And also lots of money started going to the WHO in different areas. So lots of people started writing about the WHO and also about the global health system. And so you have a profoundly important guest today with Professor Lee, who's probably one of the world's leading experts on the WHO. But putting her aside, most other people have never spent time inside the WHO, but write a lot about what they think should happen, or write a lot about what they think is wrong. And I didn't think that this was the right way to sort of talk about it. So I somehow managed to do a bit of work and to get a fellowship. And I spent a year and a half in Geneva very recently and inside the WHO, basically trying to do ethics work, which I'm really interested in, and see what the WHO does in terms of ethics. And so how can the WHO be a moral leader when it comes to health and health ethics? And I also learned what the politics is like. What's the inside of the WHO? Who are they? What are they? What kind of people are there and stuff like that. So I have sort of that kind of insight into it. So sorry to ramble, but thank you very much.
Thank you. And could I ask Brian to introduce himself?
Sure, thanks, Samia. So hi, everyone. My name is Brian. I'm Canadian, but I'm living in the UK now. Really excited to be speaking with you and these other amazing panelists tonight. Like many others, I don't have a clinical background. My background's in biomedical science, which I did back in Canada, and I did epidemiology at the London School of Hygiene and Tropical Medicine. As mentioned, I'm currently in the final year of my PhD in cardiovascular science. And I also work as a clinical epidemiologist for the Medical Research Council Unit for Lifelong Health and Aging. My research interests are in cardiovascular mechanisms underlying neurocognitive decline over the life course. I've also recently put on another hat because of COVID, and I'm working as a surveillance epidemiologist for Public Health England's Immunisation Countermeasures Division. So I've been doing lots of COVID surveillance work in long-term care homes and school children, and most recently in universities. And I guess of interest to all of you, I'm also a trustee of Students for Global Health. You could say I've had a long-standing passion for meaningful youth engagement in global health, whether it be through innovation, capacity building, experiential learning, and that's led me to take part in and organize lots of policy advocacy and diplomacy activities. I've also recently been appointed youth officer for the new joint, which is titled Governing Health Futures 2030, Growing Up in a Digital World, and that's exploring the convergence of digital health and AI to support the achievement of SDG 3 and UHC, universal health coverage. And through that, we're examining existing policies to promote health and well-being of children and young people in an ever more digital world, as well as to provide a clear set of recommendations on the governance surrounding digital health, AI, and UHC. Specifically related to the WHO, I guess you could say I've always been interested in the work of international organizations. I got involved with Model World Health Organization simulations back in Canada during my undergrad. And then when I came to London for my master's, I wanted to bring Model WHO structure to the UK. And that led me to found Lawn WHO, which, as mentioned, is the world's largest Model WHO simulation. We've hosted it at King's, which you might recall, and as well as UK, which is a unified structure for Model WHO sims in the UK to provide global health policy, advocacy, and diplomacy training for students and young professionals. I've also attended, had the pleasure of attending some high-level meetings at the World Health Organization, the Executive Board meeting, and World Health Assembly, where I've written up and delivered policy statements as part of the International Federation of Medical Students Associations delegation. And I've also worked on research projects with several WHO staffing consultants, for instance, in WHO Life Course and Aging Department, and as well as with the Global Health Workforce Network Youth Hub. And I'm often in various youth town halls and meetings with Diah and other youth stakeholders, so it's great to see some familiar faces. And I guess most recently, as part of the COVID-19 task associations of schools for public health in the European region, really long acronym, I prepared a statement on behalf of the Global Network for Academic Public Health on the WHO's response to the COVID-19 pandemic, which you can find in the International Journal of Public Health. So without further ado, I do really look forward to to joining this discussion.
Thank you, Brian, and once again, thank you to our speakers for being here. I'm just going to hand over to Rebecca, who's going to be facilitating our discussion for today.
Great, thank you so much, Samia, and thank you again to all our speakers for those brilliant introductions. So without further ado, let's get started with our questions. So we're going to have about half an hour with some questions, and then we'll have time for Q&A at the end. So feel free to pop your questions in the chat as we go along. And once we get to the Q&A, there'll be the opportunity for you to unmute as well if you'd like. So our first question, we kind of touched on this already with sort of the introductions, but basically we wanted to get a bit of background on the WHO. So I'd like to start by addressing Kelley. So given your extensive experience and the research you've done in this area, how do you see that the role of the WHO has evolved since its creation?
Right, great question to start. Yes, I think all of us have a perspective over many years, but of course, WHO is about 70 plus years old. So going back a little further than that is important. So as you probably know, it was created in 1948 after the Second World War, and it's the UN Specialized Agency for Health. And what that means is that it's supposed to be the directing and coordinating body for international health work. So it had much fewer member states at that time. Now it has about 194 member states, I believe, headquarters in Geneva, 6 regional offices, 150 plus country offices worldwide. How has the role of WHO evolved? Well, it's probably useful to go back to when WHO was created to understand how it's evolved, how it's navigated tensions that have been embedded within the organization from the beginning. So when it was created, it was kind of an amalgamation of several organizations, pre-existing ones, as well as the creation of new parts of it. And largely those pre-existing organizations were focused on what are known as normative functions. So normative functions are those functions where, it's a lot of mobilization of knowledge and creation of protocols, guidelines, statistical data, technical reports, and so on. And so it continued to do that sort of work. Naming diseases is another one, really important. It's often under the radar type work. And in a way, it tends to be less controversial, less glamorous. People, often think of global health, people, going around vaccinating people or weighing babies and so on. WHO doesn't do that sort of thing. It really is about getting the knowledge together, coordinating the knowledge and getting it out there where it's needed. So from the beginning, people wanted WHO to focus on that and probably less on another area which is called sometimes technical cooperation, sometimes called health development, I suppose, where it's getting more action-oriented, hands-on efforts on the ground, and particularly in low and middle income countries. So there's always been that tension, how much it should be involved in that versus the normative functions. So that's been something to, I think over time has happened. And the other thing I think that just is worth pointing out, navigating between two things is between, I guess, a view of health and very sort of biological sciences, biomedical, clinical perspective on health, and what, what we call, I guess, the social determinants of health and issues that Sridhar has described very well, equity and social justice, but also the broader factors that impact on our health, well beyond the biomedical. And so there's, again, this kind of tension between how much WHO should focus on the biomedical versus the social determinants. And when you see WHO advocating more for things like health for all, essential drugs, access to medicines, universal health coverage, those issues, often WHO gets criticized for going beyond its original mandate. You know, that it shouldn't be doing these things, shouldn't be too political, should be going back to sort of issuing guidelines and protocols and that sort of thing. So I think over time, those tensions have really shaped WHO's evolution. And I think they certainly haven't gone away, and they're right at the, I think, forefront of what we're seeing now is what kind of WHO we want going forward. And that will continue to, I think, inform debates about how it's reformed. So I'll stop there because I know I want to get other people's views as well, but that's kind of in a nutshell how I see it evolving and perhaps navigating those tensions.
Thank you. That's really great to get some perspective on sort of the long-term aims of the WHO and those tensions you described. I'd now like to turn to Sridhar. So as someone who's looked a lot at global governance, especially from an ethical perspective, I just wondered if you wanted to comment on how you've seen the WHO's role has evolved.
Sure. So I'm trying to think, I think I'll put it much more simplistically. And I also won't be as polite as Professor Lee because she's an expert academic, and I'm just going to give you my personal view on this. So a couple of things have evolved, and I think we're at a really important moment in the WHO in its ways transforming. So the one thing that's evolved is that, you know, it was set up essentially post-World War II as kind of like the most powerful countries in the world wanting a place to coordinate health activities, but mostly sort of threats, you know, of mutual concern, etc. It evolved, I think, more into a development assistance organization, which is that, you know, in these setting these norms and standards, you know, it wasn't like the United States was ever going to follow WHO norms and standards because they believed that they had their own organizations that were much more capable of being able to provide their own sort of standards. So what happened was that the WHO was setting these, you know, guidelines from everything from, you know, how to wash, you know, utensils in a clinic to how do you build a building and how do you do various kinds of stuff. But unfortunately, what's been recognized is that they create these guidelines and then they put them away in the basement. They actually don't put them out into the world and ensure. And so that's been one of the recent evolutions, is that rather than just sort of bringing together people to create these international standards, there needs to be on the ground implementation of these kinds of things and trying to build capacity at a kind of a more regional and local level. So there's been a push largely by both by the countries in various areas in the world, but also by the major donors, that rather than being top heavy, they should be trying to make health more real and accessible on the local level. And so bringing those issues, the resources, the kind of implementation down to the ground. In that sense, if you think about Geneva as being high up and everybody else sort of low, but I didn't mean that any other way, but just metaphorically, but sort of bringing it more accessible. So that's one evolution I think you're going to see more and more, is that the regional offices are going to become more and more powerful and important, and the resources are going to go towards there. The second thing is that this DG was a revolution of sorts, in that you will see that it's the first non-rich country, non-Western DG. And this was not a small issue. This was a very big issue. And this was because essentially the member states from developing countries, but particularly from Africa, have just felt that their voice has not been heard, that their interests are not being heard, they're being told what to do, etc. And so this DG is a reflection of that kind of political shift, not only in the WHO, but in the world as well. And so I think that's an important evolution that you will see, is that it's no longer can be dominated by sort of, a benevolent, rich country, sort of approach, that this is something that's transforming. So those would be two things. The third thing, I guess, is that, there is a weekly, monthly, and a yearly potential transformation inside the WHO, as far as I could see, is that the WHO at the top is profoundly influenced by politics, in the sense that if there is a donor that doesn't pay, then that means that there's no money to pay people and programs have to shut down. So that means that they're constantly monitoring policy. They're also worried about next year's budget, and so they're constantly trying to figure out how to sort of get more money. So then there's also crises, and who's going to be angry at what crises, and how do we negotiate this and how do you negotiate that. So I think that I don't know what's going to happen in that. I don't think it's ever going to become less political, but I think that there's now a huge recognition that it's not a mundane kind of, it's not like the patent office that gets in applications and they review them and then they, publish them. This is very clearly, people are recognizing that this is an organization that has to set some sort of policy, norms, standards, and also sometimes allocates resources, and it's profoundly influenced by different kinds of political stuff. And so I think now we're going to see a full sort of acknowledgement that the World Health Organization and the World Health Assembly is a political arena, not a technical arena. And so we'll see a lot more attention being given, and it being covered by commentators and media as being a political space rather than a technical space. But those are my 3 thoughts.
Thank you. You raised some really interesting points there. I really appreciate your frankness on this. And also I think it's really interesting to think how things are changing with the new Director General, as you said, and the growing involvement of the regional office. Hopefully that will come up later again in our discussion. So now we've got some background, I'd like to move on to our next question, which I think is on an issue that's been on all of our minds. So we're going to be talking about the role of the WHO in the COVID-19 pandemic. So first, I'd like to turn to Diah. So as you're someone who's been working in the WHO in these challenging times, what are your thoughts on the organization's response to this pandemic?
Yeah, so I think my perspective, I think is quite unique in the sense that if we are talking about the pandemic now, it will be hard to not make a comparison with the Ebola outbreak several years back. During that time, I was observing from outside, if you will, and I was on the member state side at the time, and now I'm in it. So I'm all for the paradox that you put forward, Sridhar, about the love and hate in WHO. I mean, it depends on where you are at. Once you are outside, when you are in the member state side, then you tend to be very critical of what the WHO does or doesn't do. But when you're inside, like I am today, and I've been observing and in the epicenter, if you will, of this whole ordeal, I see a very responsive organization, and it's from the leadership of Dr. Tedros down to us, to the team. We work in shifts, and my colleagues, for example, my colleagues in the health emergency department and in communications department, they work in shifts coming in. So we have someone or a small team to man the 24 hours, 7 days a week. And that includes the Director General himself. He's reachable anytime, at any time, any given day. not only by us, but also by our counterparts, the ministers of health, who are dealing daily with this crisis in their countries. I see a change and a very vibrant organization. It's not an organization I imagined when I was on the outside 3 years ago. There is bureaucracy, of course. You have to have bureaucracy and governance when you navigate the world. Even if you navigate at national level, you have to have a certain level of bureaucracy and a tight level of governance. That is, of course, a given and a must. But the flexibility of a huge organization like WHO to maneuver and to transform and to change and to deal with, you know, public inputs, but also member states inputs, I think is crucial. And now I have to admit there is a bias because I'm WHO, but I'm proud to be one. And I think it's shared widely by my colleagues. And I hope we can be relevant and to our counterparts, because you know, in the end, our success is measured by the country's success of dealing with the pandemic, of dealing with the outbreak in certain countries or in all of the in the whole world right now. So I can be proud, but if that is not shared by my counterpart in national level, then I think there's still room for improvement of how we can do our job better. But I mean, if we have an indicator, if we can make the pressure as an indicator, I think to be consistently doing press briefings with open questions and answers from the global media, that is something that is continuously we have to applaud. And then the second one, the continuous improvement or innovation that we are trying to do within a very limited space. For example, the antigen swab that is being provided for low middle income countries to ensure testing is done. I think that goes that is swayed in the direction where we are trying to answer the public demand of being more responsive and being more active at country level. So that is what is needed, what is requested of us from our member states, and we try to deliver that. I think we are in a continuous improvement mode. We challenge ourselves every day. What can we do better? How can we serve our member states better? And that is the path that we are working on every day since and until this pandemic ends. So all in all, I think a very positive response from my side, because I'm WHO. I'm looking forward to hear what Sridhar and Kelley think about us and where we can do better, because obviously I'm a newbie in WHO, and you, Professor Lee, has researched this organization very thoroughly throughout the year. So I look forward to hear your inputs on how we can continuously improve ourselves. Thank you.
Thank you very much. It's really interesting to hear how your perspective has changed as your role has changed as well. I think that's very insightful. So before we turn to Kelley and Sridhar, I'd first like to turn to Brian. So seeing as you've been working with Public Health England during this time, I wondered if we could have your thoughts on this.
Yeah, for sure. I think something that we've seen as a result of the pandemic is that WHO has definitely been a key driver of response efforts, despite the scrutiny it's come under. And I think it does continue to lead the response. And a lot of member states do still look to WHO for guidance and for the uncertainty and challenging nature of the pandemic itself has meant that WHO, as Diah mentioned, has not just to be responsive but also adaptive, and it's had to go beyond addressing typical public health concerns. It's also had to simultaneously battle oscillation of public opinion. I think there's always been a degree of misinformation circulating about pandemics and outbreaks, but I think with COVID, the amount of half-truth and propaganda that we're seeing has been much higher than ever before. So I mean, alongside this pandemic, there's been what you might have heard as the infodemic, which WHO has had to fight in order to curb the spread of misinformation surrounding COVID. So I think as the disease burden intensifies and the crisis deepens, I think it's really important to contextualize WHO's response within the scope of its responsibilities, the context of their mandates and the level of also to phrase it in the backdrop of knowledge and the evidence unfolding around the pandemic. So I mean, as mentioned before, as WHO is the UN specialized agency and leading scientific body on health worldwide, I think it's time for public and political leadership, but for the public as well as political leadership, to stand firmly behind WHO and strengthen its efforts in handling the pandemic moving forward, as well as to build back better if and when the pandemic does subside.
Thank you. It's really helpful to have those comments. I think the point you raised on the infodemic is one we really need to be aware of, and the context of the WHO's response. So as this is a topic which I think we're very interested in, I'd like to now turn to Kelley and Sridhar if you'd like to comment on this.
Okay, I can jump in first, I guess. Really interesting to hear the previous two speakers. Thank you so much. So at the height of the Trump administration's criticisms of WHO, I was taken aback like everyone else. I knew that, warts and all, WHO is not a perfect organization, and anyone who knows the organization, even within the organization, knows that there's work to be done. And we've just heard that so eloquently described by Diah. And, but how did WHO go from hero to zero, in such a quick time? That was just really, to me, very dismaying. And we were applauding frontline health workers, but we were somehow booing WHO. And people don't see that connection between what WHO does and what people do on the front line of healthcare. There's a direct connection there, but we somehow have lost sight of that, that what people do in clinical settings is actually very dependent on what WHO does as well. So that needs to be fixed. But how has WHO done during this pandemic? Well, no one's going to go away with gold stars, right? Everybody's going to have to learn something. No country has got it right. No organization has got it right. We have a lot to learn from this pandemic. And, going forward, I really feel that we need to do a lot better for the next time. Nobody's claiming a perfect record here. So at the same time, how WHO has performed is really how it's been designed, to perform. It did what it was set out to do. The International Health Regulations set out what WHO was required to do, which is epidemic intelligence gathering and then sharing that information and then supporting countries. So it did what it said on the tin. That's how we set it up. It's a member state organization and it's done those things. There is now an independent panel that will look at how well the early response went and whether there was sufficient information sharing. Those highly political issues are down to one member state, and perhaps whether WHO was critical enough. Those sorts of things do not reflect on the organization as a whole. This is really quite important. We have to look at how it's structured and how it really is beholden to member states. And so we've created an organization which has limited authority, is dependent on member states, and not all member states are equal, despite this ideal that every country has one vote. We do know that some are more equal than others, so we have to look at that. And so what we need to do really is think, how can WHO be made more effective by giving it more resources, giving it more authority, and really looking at the deeper global governance aspects. global health governance, but global governance more generally. And those are the things that I think we need to really scrutinize, whether there's a good fit between how we live our world, live our lives in this world as a globalized world. That do we want to remain interconnected? Do we have an organization that can enable us to do that? Have we enabled WHO to be that organization we need? And those are the sort of questions I would ask, rather than pointing fingers, blaming individuals, and really a witch hunt, which, you know, some governments want. I think that's unhelpful, to be frank, and we need to look at the bigger picture. So that's how I would respond to journalists when they ask me, did WHO do, you know, what it was supposed to do, etc. That's how I would respond, and it's probably what some people don't want to hear, but I think that's more productive going forward than trying to point fingers and cast blame. So that would be my response. Thanks.
Thanks very much. So my view is, you know, I've not made up my mind on this, so I'm just going to tell you my mixed thought about this. So I think that one is that the WHO is not a monolithic thing. Just like us, you know, if you were to ask me how did the UK do in the COVID response, I would tell you that it's a very complicated story. It's not just about what it did, you know, what one person did, because there's just lots of arms going on and lots of different kinds of things going on. So that would be one kind of initial, just as an academic. It's like, you know, we need to be a little bit more clear about the question. But the question, I am not sure, I'm not clear whether the first, let's say, the first 60 to 90 days about whether or not the WHO individuals, officials at the top and on the ground could have done something differently that would have done, you know, would have evolved this pandemic differently. I don't know the answer to that question. And I've looked at that lots and lots of times, and I just don't know. The second thing is, if we just put aside those 90 days and said, has the WHO done well, I would have to say spectacularly yes. That idea that you have a consistent press conference that tells you exactly what's happening in the world and what the state of different kinds of issues are. You have the same people giving you clear information, giving you consistently, being available for questions. So there must be lots of complicated things going on in the background, but that presentation of a place and a source of reliable information, I think, was incredibly valuable, and has, at least for me and other people, provided a source that they could trust. And that became one of the most interesting things, is that it actually became a source of trustworthy news that you could not actually, you know, your own country, whether it be the US or the UK or India, you couldn't trust your own political news about what's going on and what the data is and what and stuff. And so suddenly at the WHO, you could actually sort of, you know, people were quite in stuff. And they were obviously never critical of a single country. They never can be, and they never will be. But nevertheless, they managed to give you very clear understanding of what's going on. I think they did a couple of mistakes that we will have to think about for a long time, and I'm tentatively putting them out here right now, because I don't think that they are mistakes that were incompetent. I think that we've just realized that there is a big problem here. The first one is that the WHO sees itself as a scientific and technical support organization. Its analysis tries to follow this biomedical model. And what it did is that it tried to give you an impression that the way to respond to this pandemic is like contain and control, right? So you basically identify, isolate, trace, treat. And this notion that you could apply the same standard biomedical approach wherever you are in the world resulted in the application in lots of different places where that created a lot more harm than it did in the sense of the good that it was trying to do. So the contain and control approach might work on a local level given certain circumstances, but you cannot I would think advocate that as a universal policy across countries without sort of really understanding the implications of what that might be and what the harms and benefits and all that kind of stuff. So this is not a WHO problem. This is, well, it's unique to it, is that anyone who's trying to apply a global policy based on some sort of biological or biomedical analysis, I think without also including the social into it and sort of giving more of a tailored recommendation, could have a lot more harm as well as the benefit that it's trying to do. The second thing is that the WHO only talked about the biomedical impact of this pandemic without having the ability or resources to talk about the economic impact, the political impact, the social impact, all these kinds of stuff. And it just doesn't have that resources, nor does it have the authority to talk about that. So it pushes what it knows, which is that it's supposed to be focused on health, but it's not clear that who is the other organization that's supposed to be focusing on the economics, and who's the other organization that's supposed to be focusing on the social or the youth. So that purely we focus on health in this pandemic means that we haven't really given, and so they're now setting up an economics part, and they're now setting up like all this kinds of stuff. And I've tried my best, and hopefully the long game, you'll see that the ethics has changed in the WHO as well, is that it's not just bioethicists anymore. Now you've got political philosophers and you've got other kinds of ethicists who are now also involved, so that we just don't talk about, allocating ventilators or research ethics, but we also talk about equity and justice and fairness and all this kinds of stuff. So those are, I think, like I said, I don't know about the first 90 months. The second after that, I would say it's done really well. I would say that there are some errors that are significant, but I think those are not because it's the WHO, but because this pandemic has raised some really big issues that require us thinking through more carefully over the long term. Thanks.
Thank you very much. It's been great to hear your thoughts on that. I think this is something we could talk about for a long time, and it's a very relevant discussion. But for the sake of time, I think we're going to move on to our final question now. So this is sort of a bit more of a practical question. So how can we as students and future healthcare or global health professionals be more informed and involved in the workings of the WHO? So first of all, I'm going to turn to Brian as a fellow student and someone who's done a lot with student engagement with LUNHU and stuff like that. So yeah, I'd like to hear your thoughts on this.
Thanks, Rebecca. So I guess since you're tuning in tonight, you've already taken a step in the right direction, I think, to becoming more informed about WHO and its work. I think there's also many other ways to become informed about the decision-making processes surrounding WHO's work. You can observe at high-level meetings, for instance, the World Health Assembly this past year was streamed online. Policy documents are always made available online. So that's a really good way to really read about the inner workings of WHO. I always like to throw this out and think global, act local. I think it's great to get involved with campaigns and events related to International Health Days, but in your backyard. SFGH runs loads of campaigns throughout the year, and particularly this year with 2020 being the International Year of the Nurse and Midwife. So I think there's lots of opportunities to get involved. There's also loads of different working groups that organizations have. Diah's just mentioned the WHO Youth Council, so that's something that we'll hopefully be able to get involved with. And WHO also has the Global Health Workforce Network Youth Hub, which has loads of different activities. And as you mentioned, Rebecca, you can also take part in Model WHO simulations. We had to postpone LUNHU this year due to the pandemic, but we'll be back in full force in the near future, and loads of. So I think there's loads of opportunities to get involved. Just need to look.
Thank you, Brian. Yeah, I think you're right. We've got lots of interested students here, and if you look out on the SFGH channels, we'll be sharing lots of these things which Brian mentioned. So do watch out for that. I'm going to turn to Diah now, seeing as you advise the Director General on youth and how to get them more involved. I'd love to hear what you have to say about this.
Thank you, Rebecca. So I think one caveat that we at WHO now is in the process of internalizing is that youth is not singular. We cannot just say youth and then assume that is one. It's actually very diverse and with different interests, different backgrounds, different expertise. And this youth council is trying to embrace all the diversity and the uniqueness of young people. We try to open it up to not just a certain typology of young people, but we are opening ourselves up to engage with young people from different backgrounds, diversity of geography, diversity of expertise, of interests, of skills. We are trying to open that up. If you talk about only the pandemic, then there is a working group of young people to tackle infodemics, to tackle the hoaxes, which is being facilitated by the Global Preparedness Program. There is also young people who are interested in research and in particular primary healthcare. Now there is the WHO Bulletin Special Edition on primary healthcare, where it opens up opportunity for young people to write more for the WHO Bulletin. This youth council for NCD, for example, there is the innovation aspect, there is the NCD aspect, nutrition aspect. We acknowledge that young people are experts. I think that is the shift of the thinking. It's not, the experts are not only WHO persons in this case, but young people are also experts with your own perspectives, with your own insights, and that is where this council is heading towards. And if you ask me how can young people be engaged more with WHO, this is the hub. How do you want to engage? You determine what you want, what you think is your strength, and what you think is your entry point towards making global health better, towards making health policy making better. So you tell us, this is the idea of the Youth Council. And this is why we are being very careful in the process. We want to be as inclusive as possible. Of course, with I would perhaps reach out and engage you, Professor Lee and Sridhar, on how to make sure that there is intergeneration dialogue going on. So it's not just a one-way communication, and there is transfer of knowledge, transfer of flying hours, if you will, so that young people can really have a dialogue with experts such as yourselves. And this is, I think, how this organization continue to make itself relevant, and it's being by engaging young people and by being open about it. So if your interest is in NCD, then that will be your area. If your interest in like Brian in AI or in cardiovascular, it's always amazes me how these young people come, and then I have a meeting with people from young people who are experts in fields like, you know, biomedical science and social sciences and different types of background. So you tell us what you think is your entry point into WHO, and then we will try to open up many doors with us. We will engage with you, and then hopefully as the output, we can have a youth engagement strategy, where it is really a strategy of young people engaging with us as a outcome of a dialogue, of a very close consultation, and really a dialogue. Thank you.
Thank you. That's really great to hear how you're being responsive to young people and about this new youth council. I think we'll all be looking into those opportunities that you mentioned after this event. So that's it for the questions that we had. Thank you very much to the panel for responding. I'd now like to open up to questions from the floor. So I think, Natalie, you wanted to ask a question. If you're able to unmute yourself or either send it to me by chat, feel free to go ahead.
Hello. I don't know if you can see me clearly. I'm Natalie from Lebanon. You can hear me, right? Yeah, okay. So first, I have two questions. The first one is about the vaccine concerning the coronavirus. Many people here are talking about how they don't trust the vaccine. So how can we assure to the people that, I don't know if it's proved from WHO, but how can we assure to the people that it is safe to take the vaccine and they should take the vaccine? Because, you know, some people are still thinking about the conspiracy theories and how it's not safe, and there's no enough studies and evidence that it would be safe. So that is my first question. My second question is that since I have lately finished my BS degree in public health, and I love all the fields of public health, but I want to know from your perspective, what would be the best or the most relevant master's degree to achieve, so it could have a real effect on the community and a real effect from your perspective and from WHO perspective. Thank you.
Okay, those are two great questions there. Maybe if we could have one or two panelists respond.
Perhaps I might make an attempt to answer. With regard to vaccine, right now there are 11 vaccine candidates in phase 3 clinical trials. I don't think there is one or two or more that are now finished the clinical trial and have been reviewed. And so we are now in a waiting mode, and information on that, you can go to the WHO website and you can see the ACT accelerator information, where we have 186 countries already joining in the COVAX, and we are still raising resources to fulfill the required amount of resources to be able to have a complete and robust ACT accelerator, which deals with vaccine, therapeutics, and diagnostics. So there is a complete information on that. I understand that there are countries that have taking a step towards thinking towards issuing emergency use authorization, and I believe that is the complete sovereignty of a country, of a nation. That is the regulatory decision of a country to decide. However, from WHO perspective, we can say that there is not one yet that is on the finalization stage of the phase 3 clinical trial, so we are now still in a waiting mode. But for your second question, that is really interesting, because I think, Natalie, you study anything like what Professor Lee and Sridhar already mentioned. They have such diverse background, academic background, and they are making their impact. And and it's supporting our work, doing good to the society, making impact in the community. So whatever you're studying, I think will be beneficial to all. But perhaps the academics in this room can give you a better advice. But my advice is you cannot go wrong as long as you study and you have that you are already in the field of health anyway. Thank you.
Let me take a couple of attempts just very quickly. So one is that the trust regarding the vaccine, you make it sound like you have full trust in the vaccine, which makes me try to ask, how did you get that? And what is it that you know that I don't know about this vaccine that makes you think that that it's stuff? So I think one is that there is your question. I don't know whether it was related to the WHO or in general. We're talking about the WHO, and if you had something in relation to it, one is that I think it's absolutely right that we support institutions and support our efforts to provide vaccines to everyone in need and get them in the priority that is right and beneficial to the aims that we want. But I think that the WHO and vaccine story is very complicated, and it's not only WHO. This involves Gavi and the Global Fund and all these other kinds of actors as well. So it's a very complicated story. So I think that I'm just going to sort of say that trust in vaccines. So I should note a couple of things. One is that I sit on different committees at the WHO that's currently looking at, that's developing guidelines on COVID therapies and lots of other stuff. So I probably shouldn't say anything. The second thing is that I'm also involved with lots of different policy and committees on London and the UK about vaccines and delivery and all that kind of stuff. So, I'm going to say just one thing. I appreciate your intuition that we should be supporting trust building exercises regarding the vaccines, but I'm not so sure what the question was about in regard to the WHO. The second thing is that I would, while if you've just finished a BS in public health, then you should be doing public health. And I think that that's, instead of thinking about what your next degree is, I think you should go and get some practical experience on what does public health look like on the, sort of in people's lives. So how do we identify interventions? What are the interventions? How does it work? How does it not work? What are the practical issues? Before thinking about the next degree that's going to help you or, sort of stuff like that. I think what's more important is that we get more people who are working in public health or academics of public health or commentators of public health to actually do public health. And then we will, I think, do a lot more. I think there would be a lot of really great things to come out of that kind of joint experience. Thanks.
I would like to make one point clear concerning first, thank you for your answers. Concerning the first questions, no, I don't have anything to make me so sure. That was, the question was for me too. Yani, I'm asking for evidence to be sure that we should really take the vaccine or not. I mean, not or not, but how can we trust, or what are the evidence that we trust? But thank you for your answers.
Thank you very much, Natalie. And to the panelists for your responses. So we've got a couple of questions from the chat. So I'll start with the first one, which is from Rachel. So firstly, I have a special interest in access to medicines and would like to know your thoughts on the response to COVID vaccine nationalism and related plans to make vaccinations available. Kelley, would you like to respond to this?
Yeah, happy to. Just also participating in some vaccine planning. Suddenly it's all happening, isn't it? So very exciting this morning with the approval. How do I see vaccine nationalism? I see it as the equivalent of people hoarding toilet paper, to be honest, you know, to put it really bluntly. I think it's a human nature to just kind of, you know, look to your own, but I think we have to resist this kind of reaction, that we have to recognize that this is not helpful, it's not necessary, and really, you know, if we're thinking about what's going to be most impactful, it's very short-sighted. So this Pfizer vaccine being approved is very exciting, what we've all been waiting for, you know, now it's all happening. But if we acted at the national level the way we're acting at the global level, I think there'd be a great outcry. You know, if you decided in the UK to give the vaccine to the richest or the most powerful people first, I think there would be a huge outcry. So why aren't we so morally outraged that we're doing this at the global level? It just seems, you know, a little bit of a disconnect there. So I would say that I think we need to continue to argue that the way that high-income countries are trying to play it both ways, you know, paying into COVAX facility, but also buying up the world's supply of vaccines so that there's very little left, is a contradiction, is morally repugnant, but also not in our self-interest. So we need to argue that very clearly, and that a competitive rather than cooperative approach is not going to get us where we want to go, which is post-pandemic. We want to make sure that those who really need the vaccine the most, whether regardless of what passport they hold, where they're sitting, need to get the vaccine first. So I think if we make that basic argument and draw the analogies to our local and national communities, that may get that message home. I would hope so. Yeah, we're facing a really interesting time when, you know, the vaccines are coming online, and we'll see how they roll out at national level. And if we could build on how it goes at national level and draw these global analogies, I think that might be the way forward.
Thank you. It's a really interesting comparison of the global and national scale. I think, Brian, you also wanted to comment on this.
Yeah, sure. I've also been involved with some vaccination talks through my current work with Public Health England. Our department sits on loads of JCVI meetings, so we do hear and recommend on a lot of things. I think WHO has been doing really great work towards ensuring vaccines for all through its COVAX Global Vaccines Facility Initiative. And you know, I think, you know, as Dr. Tedros has mentioned, I think sharing finite supplies strategically and globally is in every country's national using the vaccines or not. So I do think, you know, and supply nationalism, like Kelley mentioned with this toilet paper analogy, it's already exacerbated the pandemic and contributed to, you know, lots of failures in the global supply chain. So I think we need to learn lessons from that moving forward with the licensure of these vaccines. So I think, you know, it's definitely, and what I find really interesting is that, you know, that there is an ambitious effort, you know, to create this global system of vaccine equity, but it is being undermined by some countries who, including those, some of whom have actually made a commitment to equality by signing on to COVAX. So I think it's a really interesting thing to look at, for sure.
Thank you very much. I think we've got time for one last question, and actually the two questions in the chat tie in together quite nicely. So I'll read out Jav's question. So, considering the funding requirements and operational structure of the WHO, how can the organisation steer its development independently and without compromising the socioeconomic, political and enforcement limitations that member states may want to impose? I'll open this to the panel and whoever would like to respond.
I'm happy to jump in. I don't want to hog the microphone though from others, but I would just say, you know, the funding issue is really fundamental. If you understand how WHO is funded, it's the assessed contributions, which are like a membership fee, and then you have these voluntary contributions. But both of those are very dependent on an organization. The organization is very dependent on member states through that funding model. And what really we need to look at is maybe in addition to increasing both of those, and particularly the assessed contributions, I think, because that's controlled by the World Health Assembly, is really to think of a mechanism where we could fund the organization through some sort of taxation. And I know in some circles that's a dirty word, but taxation, right, whether it's on some global financial transactions or something that really unties it from member state control, and particularly some donor member state control. I think that would give WHO a much more independent basis on which to do its work. And it ties up to, I guess, the question that I think Rachel asked as well around authority, is that we need to be able to give WHO an existence beyond its member states. Its state sovereignty is fiercely protected by countries, and largely the most powerful countries. They don't want WHO interfering in its activities, or its decisions. But the problem is then that WHO is very limited in what it can say. It can guide, it can recommend, you see, resolutions and so on. It can never tell member states what to do. And sometimes in the future, we might consider that WHO does need to tell and require countries to do certain things. So we have to think about where we need WHO to have more teeth. And there's been various proposals to do that, creating a kind of like a kind of inspection, like an arms inspection kind of unit, or maybe having a system of carrots and sticks, incentives, but also punitive measures like the WTO. There's lots of ideas flowing around in terms of how we can increase the authority of WHO in different ways. So I think that needs to be sorted out as we go forward with WHO reform.
If I may add to Professor Lee's point, Rebecca, may I jump in?
Yes, of course. Yes, please go ahead.
Thank you. I think we can go back to issue about WHO empowerment. I think how it is empowered to navigate better, as Professor Lee has pointed out earlier, and right now, the measurement of countries doing the achievement of countries is measured within the international health regulation. And until recently, until the joint external evaluation was done, the IHR was done as a self-assessment with countries. And I think the joint external evaluation now enable, at least if not using WHO's own hand or mechanism, at least it's experts that are doing the assessments. It's not a self-assessment, and it's more objective. That is one. I think enabling WHO as from the resource perspective, there are two, I think, big and important and strategic steps that have been taken during this pandemic. One is when WHO had a fundraising campaign with the global citizens. And I think at that time, WHO opens up and really reach out to the public, asking for the public ownership of WHO and its work, which relates directly to the livelihood of people. And then the second, which is now just established, is the WHO Foundation. It enables WHO to, there is a mechanism outside of the member states payment, if you will, and people can directly engage with the WHO Foundation. So there is this, I think, a strategic shift in how WHO is making sure that there is a healthy balance between member states' contribution, especially with the donor perspective, and also opening up other parts of the population, of the public, to support WHO work through the WHO Foundation. Thank you.
Thank you, Diah. Those were some very relevant points. I think, Sridhar, you also wanted to comment on this?
Yeah, so just a couple of quick points before just coming to the end. I think it's a really important point about the idea about, some sort of financial independence, or sort of trying to figure out how we can get the organization to do it. So, there's been a couple of things, which is that this assessed fees are based on, I think, gross domestic product of a country, and this is like decades old, and they actually haven't been updated. And this is one of the things, is that the countries who are the bosses of the WHO don't want to change the fees that they want to pay to be in the WHO. And so until they decide that they're going to, sort of change or update their thing, there's going to be no money. So that's one issue. The second thing is that, these other kinds of sources of funding, whether through foundations or stuff, I think is the only kind of way of doing it, or other countries have to give more money. But no country is going to hand the WHO money without strings. That's just impossible. And you just don't think of that as being a rational reason, whether it be through a couple of steps back or somehow there'll always be some sort of influence, because that money, governments don't have money, they have their taxpayers' money. And so they will always say, like, we have a responsibility to our taxpayers to make sure that it's money well spent, and therefore we want to make sure that it sort of goes well. So there's a couple of complicated things with how to get more money into the WHO and what that means. The second thing is that I really want us to think harder about whether more money will make everything better. I think that when it comes to the idea of health and healthcare, more money doesn't make more people healthier. It's something happens there where you can spend $3 trillion in the healthcare system in the United States, for example, and people are not the healthiest in the world. In the United Kingdom, we spent billions of pounds a year on healthcare, but that doesn't mean that we are sort of healthier. So there has to be a much more clarity in terms of the WHO's purpose and whether more money will actually do what the WHO, what we want the WHO to do. And this goes back to Professor Lee's problem that she identified as sort of like, what is the WHO we want? And so do we want the WHO to make people healthier, or do we want it to do certain kinds of regulatory things? What is it that we want it to do? And what is the right amount of money to sort of do that purpose? So I think that's really important. The third point that I want to make is that when it comes to global governance, and this is where my political philosophy hat kicks in, is that for a long time, we have wondered whether we should have a global government as one government. And lots of people have thought about this and thought about whether justice, global justice, human rights would be better suited if we had one global government rather than all these different stuff. And for a long time, we have all sort of been on the side that it's not a good idea to go for one government, because if the one government turns out to be bad or corrupt or horrible, we don't have an escape from it. And so it's much better to have sort of multiple sort of avenues, and we'll do some sort of other kinds of issues. So this is the same, I think, with the WHO and trying to put everything to do with health into one sort of organization. So what we have right now is a complicated story of WHO, but then you've got the Global Fund and Gavi, and you've got all these other kinds of international organizations as well. So we need to think a little bit harder about, do we want to try to consolidate everything into one institution and hope that it'll always be good and right? Or would it be better to kind of divide up different kinds of things across different institutions and try to use a less sort of different effort to try to make sure that we try to get the goals that we want done in terms of health and global health? So those would be my three responses, but thanks very much.
Thank you very much. I think we're unfortunately going to have to bring the event to a close now. It's been a fascinating discussion. Thank you very much to all our panelists again for joining us. I'm just going to hand over to Georgie now for some final remarks.
All right, I'm just sharing my screen. Yeah, I just wanted to say thank you as well for me, and I'm sure everyone here. Thank you to all four of you for taking the time to talk to us. I found this really, really interesting and especially relevant. And it was insightful to hear each of your different perspectives on it from your different roles. So I'm sure I speak on behalf of everyone in thanking all of you. It would be great if those of you who have attended could fill out a feedback form to help us with future events. There's a QR code on the screen, or I put the link in the chat. And we've got an event next Wednesday on antimicrobial resistance, which should also be really interesting. So it'd be great to see some of you there. And our social media, I put on the screen, can give you more information as well. So that's all from us. So thank you again to everyone for joining us.
Thank you very much again.
Thank you so much for the invitation.
Thank you. Thank you for the invite.
Bye-bye.